Hi everyone, we're back, and today we're on sessions 3, and the topics are: what is GCS? What are the signs of a blood transfusion reaction? Why is a cervical collar put in place? And why is mechanical ventilation done? So let's get started with the first topic is, what is GCS? GCS really stands for Glasgow Coma Scale. And this is, to all extents and purposes, a neurological assessment. It's very basic, but it's very important in the clinical setting. And it's usually done on every patient. Some people do it more frequently. Sometimes it's done at the start of the shift. But this is what it stands for. It stands for, you have eye opening, you have motor response, and you have verbal response. We know that usually when a nurse does an assessment, what she does is she checks that patient to see if that patient opens their eyes spontaneously or to voice. Or sometimes you may have to inflict a mild amount of pain to get patients to respond. Then the next one is the motor response. You have varying degrees of motor response. And that's because sometimes you have people who have injuries. The normal person responds when you say raise your arm. They do what you ask them to do. But in the case of a person who's had a stroke or some other kind of damage, probably from a trauma, you do not always get the appropriate response. So sometimes pain is inflicted to get, person withdraws to pain. You can just take a look at the numbers and go more deeply into it. And then you have verbal response. We all know that when you ask someone a question, sometimes they answer appropriately and sometimes they don't, depending on if they have a level of brain damage. Sometimes you may ask them their age and they tell you their name instead. So what if the year it is, they'd have no idea. So it just depends, and you can just follow the guidelines for this neurological assessment. Next, I've given you an example of what happens when a nurse does an assessment, and the patient she assesses is, we've got this situation here where this nurse, she's in a hurry to go to lunch. And she looks at this patient, and he's obviously not responding. There's no GCS done. She should have done. And she leaves a pill at the bedside. She comes back to find that the pill is missing, not surprisingly, and still she's not done an assessment. And I know you may think this is surprising, but it can happen. Sometimes people's priorities are wrong. And so if the normal thing to do, if you spoke to a patient, which is part of the GCS, you would put what was appropriate for that number. That person did not respond. You would put again what's appropriate. But if the person doesn't respond, you just don't leave a pill at the bedside. And of course, it's no surprise that when she comes back, she did not find the pill. Now, the problem is, who's taken the pill? Was it a visitor? She doesn't know. She doesn't know who's taken that pill. So pills generally are not left at the bedside. Not in a situation like that. Now we're going to move on to blood transfusion reaction. And this is very important because we all know that people transfuse people with blood, and usually you have the process done in the lab of cross-matching. Great pains are taken to cross-match to ensure that it is the right person, right. We've got all the different rights. Some people say 5, some people say 7, some people go up to 10. Whatever is appropriate for your department or for your institution, I'm not going to get into it right now. What's most important is, let's assume that the person who's having that blood transfusion had everything done correctly according to protocol, including the right blood type. So the transfusion is given. And within minutes, which is what the most crucial time in a transfusion is in those first few minutes when that blood is hung. All of a sudden, that patient can develop something like, it can be anxiety, chills, flushing, itching, shortness of breath, and believe it or not, chest pain. Whatever the signs are, it's very important that the nurse takes the trouble. The most important thing is to stop that blood. Something is obviously wrong. And check the vital signs, make sure, and then usually what happens if normal saline is usually flushed through when you stop the blood. I'm not going to tell you what to do. You follow your institution's policies and procedures. I'm just going by what I'm used to. And typically the tubing from that blood is saved, and it's very important that it is, because it has to go back to the lab to be to be checked out all over again. You don't just take it and throw it in the trash. And of course that patient has to be watched and the doctor has to be notified to be sure everything's okay. Now we have mechanical ventilation. Now what is the real reason? What is mechanical ventilation? It's an artificial means of ventilating a patient. And typically what's happened when a patient is on mechanical ventilation, they're being provided with oxygenation because they do not have the ability to get adequate oxygen on their own. It might be a person who has lung problems, heart problems, or it might be somebody, when patients go to surgery and they have been put to sleep, they're medicated and put to sleep under anesthesia, they cannot breathe securely on their own. So they're given mechanical ventilation to assist until that procedure is completed. And of course, I've mentioned before about the heart and the lungs. When you have problems from that area and people have difficulty breathing, it's very typical that usually they call it intubation, where a tube is put in the airway, an endotracheal tube, and the breathing to help assist with the breathing process. So I hope you've gathered some information, you've learned something from all this. Have a good weekend. Bye.